Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Taylor Fisher.
And we just want to thank everyone for listening to our podcast. Be sure to like and subscribe so that you can stay informed of when a new episode releases.
And if you have any questions or topics you would like to submit, you can do that at sgmc.org/podcast.
All right. Well, we are here today with Chelsea Carter, who's our registered nurse and our trauma program coordinator here at SGMC Health. So, Chelsea, what brings you in today?
I am here to share a little bit of information about our trauma program.
All right. Well, tell us a little bit about your background personally and kind of how you got to where you are.
Yes. So I started many, many years ago as a tech at Wolfson's in the ER. And my mom was a nurse. She always came home sharing really, really great stories about her day. And it just always felt like, regardless of how her day went, she always had a win for the day. Mm-hmm. And I just wanted to have that, you know. So I wanted to be a pediatric nurse. I wanted to work in the ER. And I did my 1 year and learned very quickly that that was not for me. I love all the babies, don't love caring for the babies. Yeah. So fast forward a few years, I went back to nursing school, and I'm from Jacksonville. So I started clinicals in a level 2 trauma center in Jacksonville in the middle of Duval, and fell in love with the ER there. And was offered a position once I graduated school, started there, and I was very, very fortunate to have some great mentors in that hospital. I had a couple that I just wanted to be like. You know, you always have that kind of example of you just want to grow up and be, you know, that cool as a cucumber person responding. Doesn't matter what they put in their room. They're just happy to be and, you know what to do in every environment. And I just wanted to grow up and be that way. Mm-hmm. I'm still working on it. It's a work in progress. But so long story short, that's where really I fell in love with ER nursing. And I'm not, like I said, not from here. My husband's from here. We've moved. And I thought coming to Valdosta that I was just going to work in this small, slow-paced, calm, quiet emergency room. And it was just going to be fun and, you know, easy peasy. Yeah. And I was humbled very quickly. But in reality, I mean, I love it. It was a big difference coming from a city to a town, you know, Valdosta City, and just not realizing the differences. Mm-hmm. But that's kind of what got my foot in the door here. I started night shift as a charge nurse, kind of worked around to the ED educator, manager, and then the opportunity presented itself for me to come back as the trauma program manager. And I'm not usually one to say no to a challenge. Mm-hmm. And that's where I'm at now.
All right. Well, and speaking of the trauma program here at SGMC Health, so I could imagine why you thought our hospital was a little bit smaller, obviously. But over the few years, these most recent years, we've grown significantly in trauma capability. And just most recently, a year or so ago, got certified as a trauma center. So how long have you been in this role or been back in our organization?
So I started again in December of 23.
Okay.
In the trauma program.
Yeah.
Mm-hmm.
Okay.
And we were designated in June of 23 through the state. So the way that the state evaluates you is you kind of have to put all those processes in place, and you have to prove that they're working, you know, their expectations. Mm-hmm. And then they'll come and evaluate your system and your program, and they'll grant you that designation. So coming from training at a level 2 center, mm-hmm. where that's just the way that I learned things went, right?
Yeah.
Coming and working here, I had a different perspective and respect for what a trauma center can do and the role that it can provide and how those resources are then pulled together in different ways to improve the patient care. And that was a big shift for me. So that's kind of what we've been growing to do. It takes a lot of time and effort. But like you said, one of the interesting parts about our area is we funnel all mm-hmm. of these patients from our service area is huge. And it's been a struggle a little bit for our hospital to keep up with the demands of meeting all the needs of our patients. But that's where that trauma program really comes into a critical role, because if you have a patient that meets certain criteria, their injuries, that trauma activation pulls those resources together in a systematic approach to respond very quickly upon arrival within 30 minutes of that patient being here. So we've always gotten these patients, right? The patients have always come here because we're an hour and a half north or south away from a larger center with more capabilities or more specialties. We're very fortunate to have the specialties that we have here. But what it does is it just kind of takes our resources and puts them in an organized response, really fine tunes some of those processes to ensure that the patient's receiving that level of care within an appropriate amount of time.
Because time certainly matters in a traumatic event, right?
Absolutely.
That's when it's most important. And then, like you said, us serving such a large region, probably 15 counties we get patients from, a lot of those rural communities. And so they're having to travel. So naturally, they're already having to travel to take that time to get here. So important to take out any unnecessary steps and be as quick as possible so we're ready for that.
Yeah,
Trauma to get
definitely.
here.
What kind of traumas do we see most often, do you think? Or is there one that we see more than others?
Yep. So that our injury prevention program really focuses on looking at that data routinely. So for all of 24, our falls were going to be the highest. That's pretty standard across the state. Your MVCs our MVCs are significant. We're right
Motor
on
vehicle
75.
crash.
Yes.
I'm just assuming.
I'm sorry. Yes.
I know we use a lot of acronyms and stuff here. So.
Our car accidents are going to be a large number. We have a lot of people traveling. We also have quite a few assaults, penetrating injuries. So we have a good variety. We have a farming community, so it's not uncommon for us to have our fair share of agricultural injuries, farming injuries. So we get a good variety.
And what would you say is the most important thing for ensuring that a trauma program is successful?
For everyone to understand in the health system that they are a part of the team. So if you know me, I take advocating very seriously. I've always been passionate about that. I loved being the educator in the ER because that was kind of that middle person between management and, your team, where you could just help everyone be their best self, right? Provide that resource. The trauma program is, especially my role, is really the same foundation, where it's not, trauma doesn't only happen in the ER, it doesn't only happen with EMS, it doesn't only happen in the ICU. It's our whole system, really. So it's taking this one department, we look at that patient from pre-hospital care injury, we're evaluating that care, we extract all of that data all the way through OR and recovery to discharge and rehab. And we are making sure that the care is appropriate, that it's timely, that it's, evidence-based, best practice. And if we identify an area of need, or we focus a lot on process improvement, where then, okay, how do we fix it? And that trauma program in general is almost that intersection of critical thinking, teamwork, and advocacy all in one, because I love to advocate for those nurses. And what do you need? If you have the tools you need to do your job, you have the education, you have the resources, you'll confidently show up to work and feel good about what you're able to provide at the bedside. But in the same token, our patients this is their worst day. This is they're unsure about what's happening. They don't even have a lot of times a frame of reference to understand the impact that this injury is going to have into their day-to-day life. How do they get through today? They're in pain. They're anxious. They're scared. how is it going to impact their family, their jobs, their ability to provide, long after you get out of surgery and you're stable again, And so taking that moment, you really have the ability to step back and realize the impact that you can have on your team in the hospital, and that includes everybody and the patient, and then bringing all of that together.
Yeah.
That's powerful.
And I hadn't even thought about like that as from the nursing perspective, and too, like obviously you have your patient, a trauma happens, it's, all these things start happening coming in, but like for a nurse to feel confident and secure in that any moment a trauma could come through and I feel comfortable to do my job and I'm not like nervous about that or
Right.
I've never really thought about that.
Yeah. I mean, I would be nervous, but I'm not a nurse and I'm not trained for it, which is why I'm not a nurse. Can we talk about injury prevention? Because I know that is a piece of what you do is going into the community and making sure people know how to prevent these different injuries.
Yes. So we have done a lot of, we're happy, first of all, anytime anyone calls and asks, even if they have a need in their, from daycare to schools to businesses, if it's, whatever form or fashion that might come in, we're always happy to go and provide what resources we can or bring other community partners to the table. But we do a lot of Stop the Bleed education. The Georgia Trauma Commission gives us the Stop the Bleed kits. So we can go out and teach how to apply tourniquets in the event of, an injury, how to pack wounds appropriately in order to, apply pressure. We've done, I believe, every school in Lowndes County, Valdosta City. We've educated most bus drivers. All of our local police has been educated. We will go, I think we've gone all the way up to Moultrie, obviously Brooks County now. We're kind of that hub for providing those resources. We've done libraries in town. And one of the things that I always teach when I'm giving those resources out is it's always the first line of thought sometimes that these injuries occur in car accidents and these injuries occur, big major tragedies. And we forget that lawnmowers have very, very strong, powerful blades. And in the summertime, I can't tell you how many times we have, people are just trying to just get through the weekend and handle their normal day-to-day responsibilities. But that's where injury prevention comes in because we're more relaxed at home. Are we unloading the dishwasher and the kids are running by and we trip and fall on a knife? Unfortunately, those things happen, but you wouldn't necessarily be on guard at home, right?
Or just an accident in the kitchen, just chopping up food or something.
Or getting on the roof. And,
cleaning out gutters and you fall off the ladder. I mean, and that's kind of, we talk about it all the time, but, you've got this collection of trauma patients who sometimes don't make great decisions or, maybe they're unsafe and they might have injuries because they've made unsafe decisions. However, you have all these other trauma patients where it's truly an accident. And, you can take every, precaution sometimes and an accident still happens, but we're here for both.
Yeah, I didn't even think about just making yourself more comfortable at your house
and
stuff. How
your
you're
guard's
not really,
down.
Yeah. I know I've been trimming hedges before and on a ladder, and I know that was super unsafe. But you tend to just let me get that little.
Let me reach over and lean just a little more.
That little bit. So I could definitely see how that could
with
happen.
This powerful blade.
You get that little superhero mentality, it's not going to happen to me. But
right.
But you also talk about summer safety too, don't you? Can we talk about that since we're heading into summer soon, hopefully?
So we laugh because, ER volumes kind of tend to go up through cold and flu season. You'll see that increase. And then trauma volume kind of definitely ticks up through the summertime. But everybody's moving around. It's time to have fun. Everybody wants to be in the sun. And in the sun comes toys and, your four-wheelers and your kids are out of school and you're on vacation and you're getting in the boat and you're having all these other, it's meant to enjoy. However, we definitely see an increase in injuries throughout the summertime with kids being out of school, them maybe not having parents watch as much as they normally do. You know, mom and dad still have to work. All of their friends and buddies are around because, you know, they're all spending the weeks together. And so with our younger population, especially when we go to career fairs or we go to injury events at schools, we talk a lot about distracted driving, staying off your phone. Even music or conversations with teens in the car is a really big deal. It doesn't matter how far you're going in the car. Put your seatbelt on.
Yes.
If you are on golf carts, do not, don't pack it down with everybody in the whole crowd. If there's not a space for you to sit, just wait for the next turn. No sharp, fast, curves where people are going to fall out. Wear your helmets. Helmets are a big deal.
Yeah, and I feel like the golf cart thing has kind of been more and more prevalent. I've heard more and more people about, their children having accidents. I think people think, oh, golf carts are safe.
Like
They're
safer than
definitely
four-wheelers
safer
and
than
stuff,
four-wheelers, but they can tip over still.
Well, and that's kind of why trauma criteria exist. So when you kind of get into that scientific, nerdy part of my brain where you're looking at the biomechanics of injury and the force and trajectory, and it doesn't take a lot of extra energy to greatly impact the amount of force that the body takes. And so sometimes those cause very significant injuries, even though it doesn't seem like, the speed was that fast or the fall was that high. It can still be life-threatening.
Well, I just want to take a second to plug our Safe Sitter program because you were talking about kids being home during the summer. We do offer a Safe Sitter program. It is for middle school age children who can come take a one-day course here in partnership with the YMCA and learn safety tips for while they're home, even if they're not babysitting another child, it still is beneficial for them to come and just learn how to be safe alone at the house. But it's a very good course. It always fills up every year. So if someone's interested in learning more about that, they can go to our website and sign up for that. But we do that every summer.
I drug my son to it last year. And he was kicking and screaming. I said, nope, you're coming.
Yeah. I mean, you can never teach them enough, right?
No, and when it comes to injury prevention, preparation is key. Preparedness prevents tragedy. So it's just that mindset. You just have to, always just be thinking about what your plan would be or, how to mitigate some of those preventable things.
Yeah. So do you have any, I know we've shared some tips, but do you have any more specific tips like that, that come to the top of your mind about injury prevention or preparedness?
We could go on and on and on. So things that I've implemented in my own home, we live on a lake, and so my doors have the most obnoxious alarm on them, but for good reason, because I have a little one. I have a 2-year-old who loves to go outside. And so even though it's obnoxious and it drives me nuts every time it goes off and I have a heart attack, that's just about being prepared. I need to know if those doors open, right? A lot of times, though, drownings with that, younger kids, they're innocent and they don't have that, that fear yet, and they don't understand that it's even a possibility, and they're just wanting to go get another toy or just touch the water, and then they're top heavy and their mechanics of their body, it leads itself to have that perfect scenario where it's an accident and it doesn't take long to happen at all. But also gun safety is a big deal. Making sure that, in our homes that if we have them, that they're stored correctly, preferably locked away, obviously, from out of reach from children being able to access them.
Yeah, definitely. That's a big one. And not even just children, just
right.
anyone that's not supposed to have them.
Right.
Yeah. I mean, from what I've heard from EMS professionals, is that oftentimes the gunshot wounds that they respond to are not from someone trying to shoot someone; they're just accidentally shooting themselves.
Because it happens a lot.
Taking proper precautions.
Yes.
I like the door alarms too, especially with you living near the water. But, you know, people also have swimming pools and things in their backyards, and you can't be everywhere all the time. And, a child could wander out the back door.
Well, if you're a mom of 4 like me, I'm chasing someone.
Right.
It just might not be the 2-year-old at that moment.
And it's not that you're neglecting your children.
Right.
You're just trying to survive.
I'm just doing all the other things.
Yeah, exactly. And the gun safety, too, with us being a big hunting community, right? A lot of seasonal hunts. So a lot of people utilizing those guns. So make sure they...
Sure.
And I'm sure there's classes you can take for either of these things. I know that there's several local... swim safety courses that people can get involved with, even for children as little as like 6 months old. You know, you've seen the terrifying where you have to let your kid jump off or fall off in the pool and see if they can roll over. But it's all in the spirit of being
preparedness
safe.
is key.
Yeah, better safe than sorry, as they say.
Definitely. I know we have a great EMS team here, and I'm assuming you work closely with them, right? So how does, and this is probably pretty basic, but how does the EMS, the ER, and the trauma department, how do they all work together?
So we are siblings. And, you know, sometimes siblings, they you know, there might be some friction there. They aggravate each other. They pick on each other. But it really is all in good fun. We have a very good relationship with our EMS. We do a lot of training, joint sometimes. We've been involved in active shooter drills with our local schools where I'll go out and participate. Sometimes, you know, if I'm in preparation or trying to think through if we were to, you know, have like a mass casualty incident locally, what would that require of me in the hospital? And in order for me to be prepared, I need to have a foundation understanding what EMS is having to deal with on scene as well. So we do some joint training, but when it comes down to our trauma protocol, we really, this is a benefit that I didn't have in Jacksonville that we do have here. With us having a hospital-based EMS service, we have a lot more ability, you know, to really kind of have more conversations, to drive process improvement. A lot of times if I'm hearing something on the radio and I just have more questions, I can go out to the charge desk, and when they come in, I can talk to them. I have an open door policy. I tell everybody, if you have questions, I might have it too. You know, let's figure it out. If I don't know it, I'll find the answer. But let's learn it together. Come talk to me. Everybody's got my number. And I think that's it's just important. We're talking about our whole system is trauma. And so it starts from the moment the patient's injured and the care that they are given on scene. And so that it really requires us to make sure that we are providing resources to EMS, and then they're giving us their feedback, and that's a open conversation.
And that extends to other first responders,
Absolutely.
right? Yeah.
Yep, the trauma program sends out feedback letters to other hospitals even, and other EMS services. So we, not just our hospital-based EMS, but absolutely our other local, we rely heavily on, you know, to transport some of our patients. We rely on those services to help us. And so we try to provide, you know, as much feedback as we can and details of being that, like I said, that middle ground, that person that can advocate for both sides.
Yeah, it's a big partnership with a lot of people and a lot of wheels spinning to make everything work the way it needs to be. So probably organized chaos would be the correct term.
I would not have any other way.
Yeah.
Yes.
I always feel like the ER operated like that, you know, naturally.
Absolutely.
It's organized chaos, but y'all know what y'all are doing. So that's the best part. Any kind of advice you would give to community or, just in regards to trauma prevention? I know you've probably hit on most of that, but.
Yeah, no, we've hit a couple of injury prevention specifics for sure. I really respect the work that our team does, because we are really trying to play catch up in some form. Our community has exploded, and the benefits of having that trauma program is, being able to provide those resources that's needed. But we do take good care of our patients, that, and it always comes back to that. It always comes back to what's the patient's experience? Did we do what we needed to do? When it comes down to injury prevention, if there is any way that we can help, that's we extract out this data out of our registry, and we send it to the state, and we send it to national registries, and they give us feedback on areas that we need to improve. But if there is a space within our community that we can be more active or involved in, I will take all of that feedback. If someone posts on our site or anything that there's a need, I'm happy to jump in, and figure that out and be that resource.
Yeah,
definitely. Do you have any memorable success stories from our trauma program that come to mind that you're really proud of?
We've actually had a number recently that I was really, really proud of. One specifically that probably I will remember for the rest of my career, and it was probably just the environment in general. I think we did a story on him, but it was Steve Wise, and he was our he was a relief worker. Yes, that came in to help us when our community was in shambles. And we all did our stint here in the hospital. We were here for days, just trying to whatever needed to be done, we were willing to help, right? And Steve is actually a perfect example of, you can be prepared. He took all the safety measures. He had all the protective gear. He had the helmet on. He, was very experienced at what he did, and an injury still occurred. But he was help removing trees from a local person's home in our community, and it was a mishap. It fell wrong. It landed on his head. The helmet protected his head, but the weight of impact fell to his shoulder, so he had all of his ribs on one side were broken. And this is where that advocacy comes in, or just being able to be a resource in that moment, because we were able to have all of the team at bedside. His wife dropped everything and flew here within 12 hours. She was because he was here by himself with his team.
And he was from Texas.
He was from Texas,
yes.
Yep. So came a long way. But it was so encouraging. That was really one of the first examples that I really got to see through the inpatient, and rounding on him in the ICU and following up with that care. It was a remarkable story of recovery and resilience. And even, as y'all know, as he was being discharged, he didn't want any of the recognition or, he was just wanted his team to be honored for the work that they were doing. And I just think that we were in our own state of uncertainty. As healthcare workers, that's kind of what we're called to do, is to jump in and help our community. And here was someone that came to help us in our moment of need. And then he's, sustained a life-threatening injury that he had to give a lot of work, and he went to rehab, and he's back home with his family. His wife texts me every now and then, but they sent a thank you package to all the nurses upstairs. It was just, it was really sweet.
That was a really sweet story. We got to talk to him and interview him, and he really was, like you said, not wanting to take any credit for anything at all, and just wanted to make sure that, his team got credit, and he was, yes, remarkable.
Yeah,
It
so if
was.
you're interested in learning about his story, I'll just
Yes.
do a plug. We are sharing his story in our annual report, which will be located on our
Good.
website. So and I think he was the one we were able to do that fun discharge
Yes.
celebration. So oftentimes if we have a patient that has been here for a very long time for like traumatic, situations like that, that really gets close to our team. It's a fun thing to be able to celebrate them going home or go into their next level of care. So we all kind of gathered down the hallways and
because
gave
that's
him
why
a
we
good
do it,
send-off.
right?
Yep.
We don't always get to pull that
Yeah.
back together and have the happy endings, and so we got to celebrate those because
Yeah,
that's
absolutely.
that's hard work that the team put in that needs to be recognized. So that was fun.
Yes. So I have one last question for you that wasn't on your list.
Oh gosh.
And it's an easy one. We like to ask all of our guests what your favorite thing to eat here is, either in the Spice or in the cafeteria, because we know you guys spend so much time here.
Oh my goodness. Oh,
What's it going to be?
like lunch or
Anything.
like anything.
Any meal.
Anything that they
Anything?
make.
Okay, the Oreo pudding.
Yeah, I don't know
like,
what it's
whatever
called,
that
but
is.
some kind of Oreo deliciousness.
Yes, I can't. If it's there, I'm getting it.
Well, we haven't
that's good.
had anyone say that one, so
Oh,
that's
good.
good.
Yeah, no, that's
I am. That's my favorite.
I don't think I've had it. Is it in the
It
cafeteria?
is life changing.
I'll have to
I want
look
to
for
warn
that.
good. Yeah.
you. It's life changing.
I'll
Maybe
look for
don't
it.
ever try it because then you don't have to, you won't want it if you don't know how good it is.
Yes.
That's what I'm saying.
Well, thank you so much for being here today, Chelsea.
Thanks for having me.
Yeah, we appreciate everything you do and everything your team does to keep all of us safe and confident that we're going to get the care we need should something happen. So,
Thank you for having me.
And thank you to all of our listeners for tuning in. And you can like and subscribe to make sure you're getting all of our episodes and submit your questions or topics for us to talk about at sgmc.org/podcast.